Thank you, everybody, for coming. For those of you who don't know me, haven't met me yet, my name is Ryan Zingerle. I'm with Torrent Consulting. And if you're unfamiliar with Torrent Consulting, we are a certified Salesforce implementation and consulting partner. We are one of the few in the Salesforce ecosystem that is dedicated to the life sciences sector. More importantly, we've been really closely aligned with Salesforce on their new Life Sciences Cloud product launch, which has been really exciting for us because there's a really big shift going on in how we think about CRM and ultimately how Salesforce is trending as a technology. You'll hear a lot of comments about, where the platform is going, and no longer is CRM just considered a system of record, but a system of actions and insights. And this is really driving some of the technology changes and the expectations in the life sciences sector. A lot of the technologies that we thought as future facing or down the road really are here today. And when you think about yourselves as a company and how you have to operate, change is needed in how you acquire new customers. When you're acquiring those customers, how you onboard them, the efficiency of that onboarding, and how that data sits between different systems and communicates. When you're talking about how you collect something like samples and then ultimately post results for the products and services you offer, the efficiency of which you get that information back to your patients and providers, and ultimately the communications that you're having all the way throughout that. All of those processes there are becoming the standard for life sciences organizations and the expectations for the patients and providers you service. And a lot of the companies we work with, they come to us and they say, where do we start? They know this transformation needs to happen. They're sitting on 10-year-old different tech stacks of different technologies that the people who sit there today didn't build them. They came in and are taking them over. And it's a scary process because you kind of think, where do I start? This seems complicated. And really, that's why we're here today, is to help and give some insight into what those first steps look like. So with that, I'm going to introduce my panel. I have Dave Swiden he's the Senior Director of Salesforce Engineering at Veracyte. Veracyte is a world leader in genomic testing. And really, Dave, what we'll discuss here, walked into Veracyte, understood, quickly that he wanted to create a lab of the future, but knew that significant change was going to need to be necessary. We have Gordon Friesen, General Manager of MedTech and Commercial Patient Engagement at Salesforce. He's also been very pivotal in the new Life Sciences Cloud launch, and I love talking with Gordon because he actually has a really strong passion for the diagnostic sector, and me and him trade a lot of barbs back and forth. We have Allison Getty, who's our practice lead at Torrent Consulting, so has worked over the years with many diagnostic companies on delivering the platform and ultimately bringing that expertise to get organizations where they need to and how they want to operate on the system. And finally, we have Sean Saylor. He's our lead director of solution engineering at Torrent Consulting. He sits on the Life Sciences Cloud Partner Advisory Board. I'm lucky enough to sit with Sean with a lot of discussions. He makes me look not so smart because of how much he knows about the technology and technology overall. So he's a wealth of information. And so with that, we want to keep this conversational. By the way, on your badges, you do have some numbers on the back for seating assignments for dinner. I'm sure that'll shift as we're seeing where we sit. But with that, I want to start out from a little bit of an industry perspective, both from the life sciences industry's perspective, but also from the technology perspective. And Dave, I'll start with you. Can you give us a little just overview of Veracyte, the business itself, and kind of how you approach or think about yourself in the marketplace?
Sure. So Veracyte is a cancer diagnostics company. Our core mission is to basically help transform cancer care for patients around the world. And part of that's through diagnosis as well as all the way through treatment and monitoring. We have 4 core products, tests for breast cancer, bladder cancer, prostate, and lung cancer. Ultimately, we have U.S. patients. We have labs in San Diego, San Francisco, and Austin. And then we do have a more of a decentralized model for international patients where we actually sell test kits to partners and customers. We're big on innovation. We have strategic scientific partnerships with the scientific community. And then we have our own research and data platforms to drive innovation.
Great. And with that, you've been with Veracyte since about 2004. And much like I said earlier, when you walked in there, you inherited a tech stack, got to see it for the first time. And, those are some eye-opening experiences for someone who's thinking about creating the lab of the future and digital transformation. So with that, what prompted you to kind of think about how to change and why you wanted to change?
2024 is where I started there. Yeah, June. It does seem like it's been that long at times. Yeah, I mean, I was talking to Veracyte about the role. So I kind of knew, like, first of all, the leadership actually knew they needed to transform. So Veracyte, Decipher Biosciences merged back in 2021. With any merger like that, you're going to end up with redundant tech stacks. Salesforce is a platform that most companies have. And so, you're likely to have both of those as part of your platforms. So, I've done digital transformations my entire career. I've spent a good part of my career working on Salesforce, and SAP is another enterprise platform. And so, going into it, I knew we had to do a transformation. Right? That's part of the reason they hired me. As far as the tech stack goes, I mean, we had redundancy in Salesforce platforms. We had redundancy in other technologies as well. And, part of our mission is to, we have an acronym there. It's called SUMS. Simplify, unify, modernize, and scale. And so that's kind of, everybody sort of adopted that. What it looked like and what it looks like today, get multiple Salesforce platforms, data redundancy. Our user base is logging in both platforms at times. We're consuming the same user consuming multiple licenses. That's not cost effective long term. Each of our platforms is very tailored to a specific product family and a specific set of tests. And ultimately they're heavily customized in that direction. So they worked very well for those tests. But when you try to scale them, it's very difficult, especially with a small lean team that's, we're trying to split our work between two different platforms. We've got, year around governance constantly with the customization. Both these platforms had been built out for well over a decade. And so, we've inherited a lot of the challenges. And so, there's no question, like, we have to do a digital transformation. We have to unify our platforms and we have to do it quick.
And then from a technology perspective, there's a lot of pain points there, but how did that translate to anything organizationally or process driven that was really causing pain points?
Yeah, I mean, again, your acquisitions, you're merging companies, you're merging processes. And I would say, like, if from an order to cash perspective, how those processes work, there's a lot of similarities, but between the product lines, there's enough differences that it makes it hard. And so, one of the things that I came into Veracyte saying a lot is we need to focus on our business processes. We need to align our business processes before we even talk about the technology. And we knew that we had to, Salesforce is the platform that we want to use for a lot of our use case. But yeah, I mean, business processes are still a challenge. We have to align those. Yeah.
And then that shift to Gordon, from an industry perspective, you've been with Salesforce for a while here. You've been really focused on the healthcare and life sciences sectors. What are some things that you've seen from a change from a technology standpoint for life sciences organizations, and maybe specifically kind of in the laboratory or diagnostics world?
Yeah, I think what's really interesting is over the last few years, we've seen a shift towards or from maybe the kind of the traditional system of record kind of thinking, like ERP, LIMS, CRM, all those kind of old technologies. Very important. We still need those. But really the new kind of move forward, obviously, is going to be, how do we actually have more of a system of engagement? How do we connect better to a patient? How do we connect better to a provider to actually move those products or those tests, faster through the system, right? Not focusing maybe on the bookkeeping side of it, but the actual engagement and relationship side. So that's where we see a lot of technologies focusing now on having a better understanding of the customer, better understanding the process, and making sure that we connect to that infrastructure behind the scenes. Right. I think that's a big thing. And of course, we'll talk about this a lot, I'm sure, but AI is also a huge change in all the ways that we do all of those things.
Yeah, that's a good transition into actually getting to the platform, which I stated earlier that the thought of what CRM is shifting, especially in the Salesforce ecosystem. And can you just give some insight for this newly launched Life Sciences Cloud, like how you think it's so different than from, the traditional sales or service cloud of the past?
Yeah, I mean, ultimately what we're trying to do is provide a lot of infrastructure to support, these very specific business processes that we see in these industries, right? Like traditional sales and service cloud very powerful, but they meet very specific needs. They're not really built for a diagnostic or a pharma customer or a med tech customer building a device, right? So us building the infrastructure to provide that technology makes it easier to bring that infrastructure to bear for you in terms of customization and delivery, right? So I think that's a big thing that we're adding.
Yeah. And what would you tell companies that I think are a little more up and coming agile, like, starting out? They're not the large enterprise organizations that are thinking you're going about this transformation or, through a new technology like this itself.
I think the most important thing is, again, back to that ability for us to bring industry specific technology. We're making it faster for you to be able to build solutions, right? Again, like bring AI to the advent. If we bring the data models for the industry and if we bring that foundational technology, your configuration is less, right? Your ability to solve those challenges is faster, and that allows you to actually react to the market, react to your growth, those things a lot faster, right? So you can build that technology and deliver that next generation of AI, for instance, on a foundational tech that we're providing more of that concrete for you.
Yeah. And I guess that goes a little bit to the engagement that we're having as an organization, our partnership with Veracyte. So, Allison, when we talk a lot with customers, we talk about using as much out of the box features and functionality of Salesforce as we can. Can you talk a little bit about kind of how we approached this project or using those out of the box features?
Yeah, so last year we started our engagement with Veracyte to understand what the current state was and look at what was ahead for them. So two very highly customized orgs, right, that we had dug into. And, coming out of that, we heard the vision of we want to simplify, unify, improve user adoption, and make sure that this is a scalable platform for the future. So Lucky Life Sciences Cloud had come out in June of that earlier year, and it is purpose built for the industry. So we were able to look at Life Sciences Cloud and really identify those out of the box data models were a perfect fit for the Veracyte use case as well as other diagnostic labs, and take some of the highly customized workflows that they had and use tools like Omni Studio to build out a simplified, scalable order process. So as we're in this initial engagement, we're building out for the initial product launch, and the intention is to be able to scale that and add new products without heavily customizing the platform. We're just enhancing those processes as we onboard new products, which has been great.
Yeah. And this goes to impact, right? That's the goal of any project here, and especially in a digital transformation. And Dave, I know it's early in our engagement. Not so early. We've been working together for quite a bit here, but in terms of, the first steps you've taken into this, but has there been any real world impact or initial wins that you're seeing in terms of kind of this initial engagement we've gone through?
Yeah, for sure. I mean, let's start with today. Like, we're literally on the cusp of launching our new Life Science Cloud with a lower volume product. That was our plan to the roadmap. Start foundationally with a lower volume product and build upon that, and then eventually do a full digital transformation. We're right there. Leadership is super excited from what they've seen. The business teams. Again, another win. The business teams have been part of the journey from day one with Torrent and my team, and they feel more accountable. They feel like their voices have been heard. They feel like they're building a system that they can actually be proud of and leverage, as well as they are starting to be more fully engaged and understand how their role in a digital transformation, how important it is. Right. So those are all wins to me. And on top of that, I mean. Coming out of, if I back up to when we did the discovery, getting, I didn't have leadership buy-in completely. There was, we had to make some investments both in the Salesforce platforms and, people. And my team, there's no way they were going to be able to support what we had while trying to do digital transformation. It was a huge win to get full buy-in from the leadership. And fast forward again today, what they're seeing is actually, things are coming to fruition and they're seeing the benefits. So yeah, super excited.
Yeah. And this has been a great project, like the partnership here. And Allison, you've not only worked on this project, but like I said, you've worked with a lot of other diagnostic companies over the years. What are some of the digital transformation impacts you've seen for patients and providers, whether that be through communications, care management, orders, whatever, anything?
Yeah. Yeah, I mean, I think ultimately the goal is to improve that patient and provider experience. I think oftentimes it's easy to think about the operational efficiencies that you gain with an implementation like this, but really at the heart of it, it should be the patients and providers and getting those results as quickly as possible. And so, that's been really great to focus on with Veracyte and think about our turnaround times, how the order process is working, and really how are we communicating with those individuals who are getting the results? How are we automating it in a way that's effective, but also, relational. We're not just shooting out a message that says, hey, your results are ready. We want to make sure that we're hitting the individuals with the right message at the right time. So, for those who are in Salesforce, we also want to make sure that they've got all of the clinical data at their fingertips as well. And Life Sciences Cloud is built for that. And so having all of that information in one platform has been really powerful.
Yeah. And Dave, this is the first time we'd ever worked together, Torrent and Veracyte. This isn't like we had a long-standing relationship. So with that being our first engagement in a digital transformation process here, what do you think made it successful? And I guess what advice would you give to any other company that's kind of at the cusp of such a transition?
I don't know if I have advice necessarily. I mean, my approach to working with partners has really not changed over the years. First of all, I knew what we needed to do. I knew we needed to reimplement after the first 3 weeks at Veracyte. But talking to the team and digging into the system, it was very clear. And I knew, I knew what goals we had. I knew how to set the expectations. And so before I even talked to Veracyte, I went into it with, I think I went into it with our point for you guys to say, hey, these are our problems and this is how I think we need to engage. And these are the kinds of people I think we need. And I had a pretty good idea of how long it might take. And I had a pretty good idea in my head of, the overall cost. And, the first few meetings we had together, I was convinced that, their values and their approach to these problems was a good fit. And so, ultimately, I've always believed that, you invest in a short-term discovery engagement with a readout. And the worst case is you get some output in it and you move on. And the best case is you get, as good or better than the output you expected. And you continue on with, hopefully the A team that was working with you in the discovery session. And, we ended up that way. I think I even said after the discovery, we got to have this team continue on the path with us because it's going to be a long journey. So, I think, ultimately that's what I think it's sort of the formula that I've seen work. And the other part of that is I knew I could easily get our leadership to invest in a shorter term discovery than, jumping in and saying, hey, let's do this long-term digital transformation with this partner. It's the right partner. So I think that was worth the investment for sure. And I would say definitely do that.
Yeah, and honestly, we love that as a partner where we can just commit to an engagement where we get in the room together, we sit down together, we spend some time figuring out and roadmap it, build out the architecture, build out multiple go lives or phases if that's necessary versus committing to this massive project at once because it de-risks the situation for both parties and it really ends up being a better outcome at the end of the day.
The only thing I'd add is, our business teams, there definitely some frustration in our ability to maintain the systems and scale them, right? For good reasons. And, this engagement, that discovery engagement built a ton of trust in that process and the team. So I think that was huge.
Yeah. Yeah. And looking at the future, I mean, again, this is a brand new platform in Life Sciences Cloud. It's not even fully released yet. And Sean, you've had some under the hood access to what's coming and you know from visioning out of what's capable there. What are some of the things that excite you most about specifically for the diagnostic space?
Yeah, I think what excites me the most is finally being able to realize the vision of the lab of the future. We talk a lot about the lab of the future. What does the future of diagnostics look like? And Life Sciences Cloud is finally allowing us to realize that vision with an industry-specific platform. It's allowing us to also take advantage of some of the inherent capabilities that come along with that, unlocking your enterprise data with Data Cloud, layering on Agentforce and AI on top of that. So what we're doing is, not only being able to work with an industry-specific platform, we're able to use the data and allow the CRM to work for you. So, for example, we could take things that would traditionally be a really long manual process like TRF order entering, accessioning, and layer digital labor on top of that to automate that process and increase the throughput for your teams. leading to decreased turnaround times and overall improvement in patient care. So I think the ability to just harness all the technology and all the advancements that Salesforce is rapidly coming out with is going to be a game changer for all of our lab customers.
Yeah, and with that, AI is everywhere, right? It's the topic of conversation for any technology platform. But, as it relates to Salesforce and AI, what would your recommendation be for any diagnostic laboratory or diagnostic organization and how to prepare for AI?
Yeah, I mean, I think there's a few things. I think first, getting your business processes on Salesforce, centralizing some of your key workflows. The second is data, right? Making sure that you have data connected into Salesforce or you're able to access that data via API. And the third, I think, as a common misconception is a lot of our customers think that they need to have this fully baked, drawn out 12-month, 24-month roadmap for AI, when the reality is it's so easy to get started now with some of the things that you already have. So, for instance, one of the common problems that all of our lab customers have is providers calling and asking, hey, where's my order? Using an agent to do that, you already have that data readily available. So why not solve for one of the most common patient services use cases by using agentic labor to solve that problem for you and answer those questions? So you don't have to have a thorough, 24-month journey. Obviously we can help you get there, but there's so many small things to help get started right away that I think that customers can latch onto pretty quickly.
Yeah. And Gordon, I had already asked you once about the future of, the life sciences industry, where it's heading from a technology perspective. I want to key in on that a little bit more of, from a life sciences cloud perspective, how do you think this can really help the industry evolve overall?
Yeah. So, I mean, right now, Life Sciences Cloud is interesting because it's of the three biggest investments in Salesforce, it's our industry cloud and it's Life Sciences Cloud. That's our biggest industry investment. It's Data Cloud and it's AI. Those are what we think are going to change the industry. With Life Sciences Cloud specifically, though, we're bridging that gap between the provider world, the payer world, the patient, right? All of that infrastructure is in one box. So we can do benefits verification and order tracking. Where's my order? A customer that won't be named has about 60% of their customer-facing support time spent on where's my order. Right. Having an infrastructure where we can plug all these things together and add an agentic layer on top, we can actually just immediately take that away. Right. So now they are 60% more efficient. Right. So our goal is to really try to bring this together and actually solve some of these largest challenges for diagnostics. If you think about it, right, the thing we're all doing together, if we can get detection faster and get those results faster, more accurate, we're going to save lives and make the industry work better. We'll save tons of money and tons of lives. Right. So ultimately, we think we can provide a lot of the infrastructure to support that and make that much faster through AI.
Yeah, we got Sean's feedback on some examples of where he sees AI, benefiting the diagnostic laboratory space. Is there any ones that you think specifically that may have not been mentioned yet? And also for you, just like the same question, a little bit of how to prepare for that.
Yeah. So two things. So firstly, the way that we're looking at it is from the boardroom to the bench. We really actually think that AI can actually support individual jobs across that entire spectrum. So it could be looking across all of your data, your test data, to find new opportunities for building new products or new delivery of products. It could be, helping actually at the bench level, removing repetitive tasks that could actually be automated through AI, right? We can actually look at all of those different use cases, find a lot of quick wins. Again, you don't have to wait for a perfect system. There's a lot of places where you can pay for any additional AI project by just the effective selection of one small project, right? Like that's a really key area. I think that's what a lot of our customers are doing to be very successful, is they're finding those kind of one key little area that provides significant value and going for that, implementing, and then scaling from that, right? And I think that's a really key area. So I forgot the other question.
Just I guess the how to prepare, right? Or thoughts of preparing.
And that's a great question. And I think we already kind of covered it, but ultimately the first thing you need to do is have that data, right? Like that's really, really key. Have your data, get all the insights from all the data you've been collecting for years and turn that into action, right? And that's going to be by taking those workflows that you've identified and actually built already. A lot of these things might already be in your CRM. Granted, they might need to be cleaned up a little. Right. But ultimately, that's kind of the first thing for success. Make sure you understand where you're getting your data to power your AI. Make sure you're scaling with the business processes that you have, and then start picking those use cases that are going to get you value.
Yeah, I think I had one thing to that.
Absolutely.
Was definitely make sure your privacy and compliance teams are part of that process. Yeah.
Yeah, sign those AI addendums, please.
And as part of that process, I honestly think that's one of the biggest parts of any of our engagements is we talk about data every single step of the way through our engagements because it's just so important. But so with that, we hope this was insightful for anyone here who's looking to go down a similar journey. Our goal is to ultimately be sort of a resource for you as you go into the future where this technology is going. Little housekeeping items, but dinner will be served down the hall here. We do have 2 booths set up that have some real life examples of agentic use cases specifically for diagnostic labs that we have built on the Salesforce platform that we can show you. So we appreciate everyone's attendance, and thank you for coming.